local Light the Night. And what's great is UCLA Health is also a presenting sponsor this year. As for volunteering, you can always support other families or inspire others with your story. So please feel free to reach out to me after this program if you are interested. So right now, I'm just going to go ahead and stop sharing my screen because I would love to just present to you and introduce our speakers for today. It is licensed clinical social workers Ariella Wanger and Rebecca Pittenger.
Hi, I'm Rebecca. I am one of the social workers in the hematology oncology department here at UCLA. My primary role is with stem cell transplant patients in the outpatient setting.
Hi, everybody. My name is Ariella Wanger. I'm a social worker primarily on the inpatient hematology, oncology, and stem cell transplant unit at UCLA. I work pretty closely with Rebecca as well as the rest of the medical team, so physicians, nurses, care partners, physical therapists, and everybody who helps our patients on the unit. I can also be involved sometimes on the outpatient side and with our transplant coordinators. And overall, a social worker's job is to promote social change and empowerment of people. We use a framework called person and environment. So that means we want to know everything that's going on around a person or our patient and what matters to them, what identities they hold close to them as important, and use their power of self-determination to help them reach their goals. So in the hospital, it means that my job is to get to know our patients as whole people and be their ally and their advocate to in whatever way is most helpful to help them reach their goals and what's most important to them during their treatment process. So just for your reference, Rebecca and I both have past experience as therapists, and our license designates us as mental health professionals. So we are qualified to give advice and recommendation about fear and anxiety. Just a little background on our training. We also wanted to share that in order to eliminate any possible disclosure of our patients' information, we're going to be using ourselves as examples a lot today. And that way you'll not be worried about it if you're one of our patients or know that we're not sharing anyone's information. And we also want to acknowledge that we don't know how each of you is impacted by your own diagnosis or coronavirus or any other things that are going on in your lives today. Many of you may have other stressors beyond those two major health issues going on. We hope that this general information can help you feel less alone and give you some ideas of how to cope, and then also point you in the direction for further support if you feel that you want it. So today we're focusing on talking about coping with cancer and the new coronavirus. We thought it might be a good place to start to share some of the signs you might notice if you're not coping well, or if you're burning out or if things aren't going as well as before. So these are broken down into different aspects. The first might be cognitive. So you might notice that you're having problems with your memory, problems with concentrating. So things that you used to be able to enjoy doing, like watching TV or just reading the newspaper, now you're having a hard time tracking. Anxious thinking or worrying, or even changes in your judgment. Of course, there's emotional components to burnout or to feeling like you're stressed, such as that sense of feeling overwhelmed, being lonely or isolated, irritable, or moodier than usual, just more emotions, feeling sad, or even feeling lots of emotions quickly or changing quickly. It's also pretty normal. And it's also not uncommon to have behavioral changes. So you might find that you're withdrawing more from people that you love and that you normally don't withdraw from, that you're procrastinating or not doing all the things that you used to be able to do, and sometimes your eating or sleeping patterns might be changing too. And lastly, there's physical aspects of stress. These might be hard to separate from your physical symptoms if you're in any kind of active treatment right now. So always talk to your doctor to sort of parse that out. But some of the things that you might notice are aches and pains, changes in your digestion, loss of sex drive, or other physical symptoms. And just want to repeat that any combination of the above experiences is normal. we're living in really strange times, and I think most of us have never seen this before. Probably none of us were alive for the last pandemic, I'm gonna guess. And please know that however your mind and body are reacting to these changes, it's normal. And you're probably not the only one who's experiencing and feeling the things that you are. So on that note, I wanted to share some of the common things that I've been hearing from our patients in sort of a general way, just in case it resonates with any of you. Again, we don't know where everyone's at in their treatment process. And keep in mind that I work inpatient in the hospital. So if it doesn't resonate with you, you'll hear from Rebecca in just a minute. So one thing I've heard that I think surprises people is that the coronavirus hasn't actually changed a lot for them. Either they were diagnosed and admitted to the hospital pretty quickly, and so they've been here throughout a lot of it, or they already felt sort of isolated, like they weren't able to go out to places or see people that they really loved. They were already missing out on things a lot, and so quarantining or having to be careful about who you see, that may not have been such a big change. And that's okay. If your focus is much more on your cancer treatment than on coronavirus, if you're just not really all that worried about coronavirus, don't worry. A lot of what we say is still going to be relevant and resonate in terms of coping with anxiety. And I want you to know that that's an okay way to feel too, if just the world's bigger problems aren't resonating with you at the moment. Another big theme that I hear is that the coronavirus has led to even more increased isolation than before, even above and beyond what our patients might have experienced with trying to stay safe prior to the new virus. This is especially true for people that are in the hospital. I don't know if we have anyone tuning in from the hospital today, but at least at UCLA, we're not allowing visitors. And I know that this has been really difficult and isolating for some of our patients. And one last theme I've noticed is that sometimes people's friends and families actually have a better sense of what you might be going through. People without a cancer diagnosis are suddenly saying, oh, wow, so this is maybe a little bit of what it feels like to have to put your life on hold for something out of your control, or to have to be uncertain about what's going to happen in the future for a health reason. And many people, until either they get sick themselves or a loved one does, never really think about how that might impact their lives and how they might feel. And now everyone's life is on hold as a result of a health-related reason. So I found that some patients feel that their family members and friends and loved ones are relating better to them than in the past. I've also heard that some people take it a little too far. Then they think that they understand everything that their loved one with cancer is going through. But overall, I think people have found greater understanding. And so Rebecca's gonna share what she's heard on the outpatient side.
Yeah, I think in outpatient, we do see some people in different points of treatment. There's definitely a lot of anxiety about coming into the medical center for treatment, and especially in outpatient clinic. So many people in other positions have the option to postpone non-essential follow-ups. They're able to, do a lot of visits through telehealth and utilize all of the ways that we're kind of learning to work around the pandemic concerns. And for some of our patients, that's true. They can use those things, but for a majority of our patients, chemo and infusions can't be done through telehealth, and you have to come in. And there's a lot of fear. And I think that, it is scary to come into a medical center. You don't know how many people are going to be there. And having a cancer diagnosis throws you into a place of loss of control. And then on top of this, a lot of patients are verbalizing that they feel kind of stuck between a rock and a hard place, right? You need to take care of your health, and so we're all supposed to stay home. But for our patients, you need to take care of your health, so you need to come into the medical center. So I think negotiating that has been tough for a lot of people. And I'm going to talk more about that specific fear because I think it's really hit a lot of people. The other thing that I'm hearing a lot because I am an outpatient and I work with patients who might be a little farther out from treatment or post-transplant. Some people were just getting back to their normal lives. You know, they had been cleared to maybe return to work, or they had been opening up their social circles to see more friends and family. And then suddenly this hits us all as a community, and they're back, sadly, to a very familiar but unwanted place of having to put all of these things in place to isolate and protect themselves again. So that's been a huge loss. That was compounded by, you know, being without those things for so long and seeing the light at the end of the tunnel, and then feeling like you're stepping back. So, you know, we present you with all of these things, like Ariella said, just so hopefully something resonates with you and you know that you're not alone. But I think more importantly is, what can we do about this, right? Like we're all acknowledging these feelings, and what kind of tangible things can you guys take away from our talk today that can help? So I think the appointment fears is a good place to start. Again, just because it is prominent, and I do a lot around this topic in the outpatient setting. I think later, Ariella is going to talk a little bit about mindfulness, and we're going to talk about grounding, which can be helpful here too. So just to kind of keep in mind. But the first step that I go through with all of my patients is to talk to your doctor. There is a reason why they want you to come to the clinic. And for some people, hearing that information and sort of being walked through the decision that your provider has made for you can be comforting. Your doctor can explain why, you know, they feel it's critical for you to be here. And I think sometimes understanding their process then makes that decision feel a little bit more comfortable. It's not going to completely alleviate the anxiety, but it can help to kind of put it in perspective when you're making that decision to come in. So that is a great place to start. And then on top of that, kind of looking at the appointments and what's triggering your anxiety, and identifying areas where you can make some choices for yourself, and identifying some things that you can control. When you look at things kind of in a bigger picture, it can feel like it is out of your control, but sometimes when we narrow in on smaller aspects of things, we can identify a couple of things that can help us. So one is, you can wear your PPE, you can educate yourself and be sure that you are doing everything that you can to protect yourself. So when you come into the medical center, you're masking, you're washing your hands, you're avoiding touching your face, which I think has been hard for all of us. Please forgive me if I touch my face 3 times while I'm talking to you guys. But these are things that we can practice, and these are things that we can control. Other things, maybe you do something you love right after your appointment. So you have something to look forward to, right? You know that coming into the medical center is going to be anxiety provoking for you. So you can set a target for after that appointment to give you something to kind of distract, but also look forward to. So for me, if I'm doing something stressful, you know, planning a trip to Starbucks after to get a pumpkin spice latte, then at least I have that thing in my head that I know I'm going to get afterwards. And it does sound kind of silly sometimes to think of a reward system for yourself, but it worked when we were kids and it works as adults too. It's just the rewards change a little. Also, some things that you can do before or during your appointments. Anything that makes your body and your mind feel calm. So again, if you know that this trigger is coming, you can kind of plan ahead for it. So maybe you listen to music that makes you feel calm on the way driving to your appointment. Maybe you listen to music that makes you feel brave and powerful. Maybe you listen to Roar by Katy Perry. I don't know, it's different for everybody, just a personal recommendation, but something that can shift your mindset. And again, whether that's something that you do, like just take 5 breaths before you get out of the car, something that you listen to, or maybe something that you read. So it's different for everybody, but it is worth 10 minutes to sit and kind of think of those things that you find calming or empowering in preparation for something that you know will be stressful. It doesn't always, it doesn't always work perfectly, right? So we want to also give ourselves some grace. We're not going to listen to Katy Perry and walk into our appointments without fear, but these are things that we can practice and try different things like anything, and like a muscle, right? If you're going to train yourself to do something, it takes repetition. So you want to give yourself time, finding small moments of joy and just kind of retraining your brain to expect a reward after this anxiety provoking stimulus or something else that is positive for you. I've also talked to a lot of people about the way they're getting their information about COVID. I think that we are bombarded on social media, on the TV, on the radio, on Google, and everything else. We just have so much information coming in. Some people find all of that information really helpful and calming. Some people find it really overwhelming and need to go on a bit of a media diet. So if you are finding that you're really overwhelmed and you're not quite sure what to do because you're reading so many things or watching so many different programs, sometimes it can help to just identify 3 or 4 sources that you trust, and that's where you seek out your information. Luckily, I work at an institution that can give me daily updates that I really trust and believe in. I think that it's also worth a little introspection to see what forms of media can be the most or least stressful for you. So for me, I find watching things on TV really gets my heart rate up. I start to feel anxious and I often feel overwhelmed. On the other side, if I read the same information, I tend to digest it much better. I think that I can read at my own pace. I can pause. I can go back and kind of reread information if I feel like I need another pass. And I think it just controls how the information goes into my brain. And for me, that's really helpful. Could be the opposite. I mean, maybe there's a newscaster whose voice is really soothing to you and you just like to hear them deliver your information. Rachel Maddow's voice is very calming to me. So, if there's somebody in particular that you like to hear on the radio, whatever that is for you, whatever the way that you prefer to receive information, like I said, just kind of narrow down your sources to things that you trust and ingest that information in ways that you find calming. The other thing that I think can be really helpful is that all of us have been disrupted in some way by COVID-19. Maybe, like I said, you were just getting back to work and you were commuting into your office every day, and now you're back home. Maybe your best friend would come to all your treatment appointments with you, and the 2 of you would use that time to catch up. And now they're saying you can't have anyone back in the infusion center with you. And so that pattern is disrupted for you. Human brains love patterns and predictability. We like to store information. We like to forecast how things are going to go, and we love to be right. Our brains just love that. Our brains don't love disruptions. They don't like unpredictable changes, and they don't like never-ending timelines. So unfortunately, right now, our brains are facing a lot of those things. So one thing that we can do to kind of take care of ourselves is, jot down what your old routine was like. So just kind of outline it for yourself, and then look for places where you might be able to safely replicate or find a substitute for that activity. when I was working from home briefly, I found that I really missed my time in the car. I know, shockingly, listening to the radio. And so I started walking the dog more in the morning just to sort of replicate that pattern of leaving the house, listening to the radio, and kind of traveling. So, you know, if you used to have lunch with a friend that now you can't, you know, catch up with safely, maybe you FaceTime and you go sit outside and replicate that interaction in a way that's safe. You can build in exercise that's appropriate for you, where you used to do those things, and also setting a routine bedtime and wake time. I think a lot of us have gotten out of our normal sleep patterns because our days have been disrupted and things are kind of all over the place. So if you can replicate that same bedtime and wake time, that can also help your brain get back into a structure and a pattern, and that can be calming as well. And the other thing that I think that we can all do to kind of put some control back in our hands is we can focus on where we put our energy. So I've been saying this a lot lately. I feel like we all have sort of a set amount of energy or bandwidth at the moment, and for a lot of us it's less than we've normally been used to, and if that's true for you as well, you can choose where that energy goes. So I usually start with the essentials, things that I must do or have to kind of maintain my baseline sanity. So for me right now, it's a few beloved humans, 2 very spoiled pit bulls, my exercise and nutrition, and Criminal Minds and 90 Day Fiance. So those things, I see you, Lila. Those things, right, I put into my day first, and then I take a minute and look around and see what I have more room for. If I don't get those things in, I can kind of start to feel the wheels come off, right? So once you get in the essentials, then kind of check in with yourself. Do I have more room for something to add into my day? Something that's going to spark some joy, a craft, paint, you know, go for a walk, you know, spend some time outside. Or did I do too much today? Am I checking off boxes, and am I realizing that I'm overextended and I'm not to the end of my list yet? In those cases, I think we all need to grant ourselves the permission to say no to some things. So sometimes that's saying no to a check-in with someone who you love, but you know is going to be overwhelming, or, you know, saying no to an activity that you'd really like to do, but your body or your brain's just telling you it's too much. Maybe you wanted to exercise today, but your body just really needs sleep. So I think sometimes it's hard for us to see saying no as a gift to ourselves, but it really truly can be, especially in times of high stress. You want to just kind of check in with your coping skills and see what's going to move you in a good direction. We're not going to judge our coping skills. We're going to treat them with some grace. They've gotten us this far. Again, I'll use myself for an example. When I was home working remotely, everybody was making bread, and I just saw it on Instagram. Everyone had sourdough starters. I was like, oh, this is going to be amazing. I used to bake. I am going to make bread. I hated it. I was angry. I was doing it wrong. It was terrible. My poor boyfriend had to come and save me from, I murdered my poor starter. It died. I felt like a failure. It just really escalated to something unpleasant. But I was so convinced that this was going to help me that I just kind of kept hammering away at it. And then when I finally decided that this had served me well in the past, but was not serving me well now, it was quite liberating to let it go and say no. I was also eating the sad bread, which just was not great. So again, sometimes saying no or walking away from things can be a really good gift for yourself.
Thank you so much for sharing all of that, Rebecca. I think on that note, it's important to recognize that if you had a normal coping routine, either before your cancer diagnosis that worked really well for you, or even afterwards, but before coronavirus, and those things aren't helping you anymore, that's okay. It doesn't mean you're doing it wrong, or that what you were doing before isn't good. It just means that what you need right now is different. And we're in a really unique situation in that, I don't know about the rest of you, I really bought into this idea that the coronavirus was a short acute crisis, that when we went home for quarantine or lockdown, it was going to be a couple weeks. I thought maybe a little longer than what they said, maybe 3 weeks, 4 weeks, maybe. I didn't anticipate 6 months. And so that went from like acute crisis, which many of us know how to handle. Many of us know how to handle a couple of stressful weeks. We prioritize what's most important. We leave all the rest to the bottom of the list. We really hammer in and we focus and we just get through it. All of us have had a couple stressful weeks in our lives. But when those couple stressful weeks turn into 6+ stressful months, that approach doesn't work anymore. We need a different way of attacking the problem. And for many of you, these are two overlaid long chronic crises on the top of each other at the same time. I know many patients with a new cancer diagnosis also feel that it's an acute crisis that may be over very soon. You just have to get through that one treatment or just this first part to learn that it often is a longer chronic process that you have to integrate into your life. And so dealing with both of these longer chronic crises at once is really just an unheard of level of stress, I would say. And therefore what we need to do about it, I think, is different. And it's okay to recognize that the things that you did before, if they're not helping, that's okay. It's pretty normal. I think all of us have had failure of a coping skill in the last 6 months at least. And so we pretty much need to switch gears from that acute based coping, like let's just only, eat, sleeping, power through it. We also need to take time to figure out how to connect to our loved ones. We have to get through the day to day for a long time, and maybe for longer than we anticipate with this problem. And so the first one, and it sounds simple, but it's not, is that we have to accept that this is our reality. So 2 of my favorite tools for this are mindfulness and grounding. Mindfulness is a practice that has roots in Buddhism and other Eastern cultures and was brought into Western culture in the last half century or so. I'm sure many of you have heard of it or maybe even already practiced mindfulness, but for those who don't, here's the definition. Mindfulness is the psychological process of purposefully bringing one's attention to experiences occurring in the present moment without judgment. 2 important parts. Sorry. Apologize about that. So the 2 important parts, the present moment and without judgment. The judgment part's the hard one. So we have to accept how reality is, what we feel about it, what we think about it, and just sit with that. That's step 1. My second takeaway is that we're already probably doing the best we can with pretty unreasonably difficult situations. And so give yourself a break, practice some loving kindness. I hope you feel at least a little bit validated by me and Rebecca sharing some of what we have already. But I want you to start to tell yourself that the way that you feel is normal and okay too. Some people like to journal this or say mantras, keep track of your inner dialogue, whatever way works for you is fine. So neither of these techniques are going to change the situation, because the reality is we can't change the situation. What we can change is our perspective on it. And so the best way is to stay right here in the present moment, which is the only thing we really do know about. And that's where mindfulness can really help. So if you and I, or all 56 of us, are sitting here and noticing just the smell of where we're sitting, and what it's like to sit, how it really feels to have your behind in the seat. If you do that for long enough, you start to notice that you don't also have space in your brain to worry about what's going to happen tomorrow. And that's why mindfulness can help with anxiety, because it keeps you here in the present. There's an important distinction here I want to make, is that mindfulness is not always meditation. It certainly can be, but there's a lot of ways to practice mindfulness. The goal is to stay in the present moment and notice how you feel and how your thinking, and maybe what your physical body is doing. Even if what comes up is anger and frustration and a sense of overwhelm, it's not about necessarily feeling calm. It's just about knowing what is right now. And so you can do this in pretty much no matter what you're doing. You can mindfully eat, you can mindfully sit on the couch, you can mindfully take a walk around the block, or even mindfully breathe. So you don't have to get into meditation to practice this skill. Another thing you might try is called grounding, which is going to keep you focused on your physical body. A lot of the time that's easier than focusing on your thoughts, especially if you haven't had much practice noticing the way that your thinking patterns go. So my favorite is to look around and say, preferably out loud, every single thing you see and what color it is. You can practice after this presentation and you will find that it is really hard to worry about something else when you're saying a lot of colors out loud. If you're colorblind, you can just say everything you notice, that's okay. And there's a lot of different grounding skills, but they all have the same purpose of bringing you into the here and now. I think Rebecca might have another example for us.
Yeah, I always like the 5, 4, 3, 2, 1. So you look around, you say, again, it out loud or to yourself if you're in a room full of people and you're trying to ground. You can say 5 things that you see. Right? Look around the room, 5 things you see, 4 things that you can feel, right? So right now I feel my feet on the floor. I feel the cushion that I'm sitting on. I feel that there is a string loose on my blazer that I need to address. And then we keep going down. So 3 things that you can hear. I can hear my computer buzzing next to me. I can hear cars passing me outside the medical center. I can hear people on the other side of the door that are accessing the cleaning closet, 2 things that you can smell, and 1 thing that you can taste. So they get harder as you go down, and you have to focus a little bit more, but I really like this, or any version of this, when you feel like your thoughts are kind of starting to run away with you. When you feel like your anxiety is getting high and you're getting into that like forecasting and kind of, thinking about things in the future and it's getting negative, I think really focusing on literally the room that you are in, the body that you are in at the moment, and really bringing yourself back can be a really good place to start, or even to stop that escalation.
And so once you've gotten some practice at this of just noticing how you feel moment by moment, day to day, you'll start to notice how you feel in specific scenarios. What activities, thoughts, or behaviors make you feel relaxed or grateful or renewed? Personally, I notice that sometimes when I relax on the couch getting all ready to watch some trashy TV, I actually can feel more anxious than I thought I would. And then I get up to start making dinner and that all goes away and I start to feel better. So what brings us a sense of peace or gratitude or calm is likely going to change day to day. That's because we're not robots and we change day to day. What our body needs changes. That's normal and anticipated, which is why we have to continue to check in with ourselves. How am I feeling? What's my body saying to me? And what can I do differently that might change how I feel? But you'll also start to notice patterns, and you'll start to notice things that bring you joy every day. And it starts to feel a little bit like a superpower if you can like tap into it. Like, what can I pay attention to that is going to give me those moments of gratitude, happiness, or even joy? And I'm talking about moments, glimpses, a couple of seconds here, not weeks. This isn't like a magical change in our scenarios, but it might just be you walk outside and you take a minute to notice like how nice it really feels to feel the sun on your face. Or when you sit down with your cup of coffee or tea in the morning, you inhale it and you breathe and you taste it and you really sit there for a couple of minutes, and that can feel pretty great. And so over time, all of those moments can start to add up, those like little minute seconds of gratitude and kindness and joy, and they can start to help us combat the overwhelming anxiety of the situation that we're in. And so, like I said, remember what felt really relaxing and rejuvenating yesterday might not have that effect today. That's fine. You're not doing it wrong. Just notice what's going on. Preferably try to not judge yourself for it, and take it as an experiment and an opportunity to try something else.
I struggle with mindfulness myself. It's, I'm trained mental health professional, but sometimes, quieting my mind is not always my best thing. Um, and so I like to think of it as like feedback, right? Like my brain is giving me some feedback, and it's sending me some thoughts and some feelings. And one technique that I've developed that kind of helps is I'm mildly obsessed with Harry Potter. And so when they do spells, they do a swish and a flick. And so I just when I'm trying to kind of be mindful and present, I just let the thoughts pop up, and then I swish and flick. So it's like, oh, that was interesting feedback from my brain. Great, onward. So not to let it, marinate and kind of bring me to the place of anxiety, but to acknowledge it, not be frustrated with myself, not be angry or hang on to that emotion. Acknowledge it. It's feedback from my brain. Excellent. Onward.
Yeah. Us mental health people have a saying, thoughts are not facts. Seems obvious when you think about it, but I don't think I knew that before. Like, I think I believed everything my brain told me.
Yeah, don't believe everything you think.
Yeah, not everything you think is true all the time. It's pretty fascinating. So you can think it and notice, wait, that's not right, and just kind of let it go. Yeah. So I wanted to just touch on this like idea of self-care, which you'll notice I don't think either of us have said this whole presentation. I think in culture, and especially recently, we've heard a lot of take care of yourself, practice self-care. This usually means, for whatever reason, take a bubble bath, drink a glass of wine, or do some coloring books. I don't know how those became the activities of self-care. I would like to offer up the idea that we can't get through really stressful times by ignoring them for an hour. Like you're not going to get through the stress of dealing with the cancer diagnosis and also a worldwide pandemic by taking a break and coloring for 30 minutes. Please, if you enjoy bubble baths and wine and coloring and any of those other things, please do them. I like all those things. They're wonderful. I would just try to say that our self-care has to be woven throughout the day. That's why the mindfulness helps, because it gives us just, endless opportunities to check in and notice the little positive things that are going on, and gives us that consistent gratitude, because 1 hour can't knock out a week's worth of anxiety and frustration. It's just not going to do it. So continue to experiment, try things that feel like they're going to work. If they don't, try something else, circle back to it and see if it works again in the future.
Yeah, and also don't do everything at once, right? In my hunt for new life skills, which is a constant goal for me, I have been reading a lot of things by Steve Cam, and he does nerd fitness, which is super fun if anybody's interested in nerd things like Star Wars, and also chin-ups. But they focus a lot on nutrition and fitness, but also on mindset, which is where I really get interested. And they talk a lot about 1% improvement. And this has served me really well as someone who really, strives to do everything and go, and like, oldest child syndrome. It sounds like it's not enough, right? 1% improvement. It sounds like nothing. Like you'll never get anywhere if you're just improving 1%, but it's achievable, right? It's absolutely achievable. It's almost too easy, but it leads to exponential growth and change. So you don't need to be perfect today. You don't have to change your whole life today. You don't have to change your mindset. You don't have to go from anxious to absolutely perfectly calm every day, because that's not realistic. All you have to do is just 1% better than yesterday, and you're on track for amazing changes. So that's something too that I've been kind of repeating to myself is I just need 1% improvement. So Nerd Fitness, Steve Kam's book, fun resource that, you know, if you are Googling and have some time, I've found it really helpful. So with all of that said, if you need more help, right? You know, these things that we're talking about might not be helpful for you. Maybe you need more. One thing that you can do is, if you're at UCLA, obviously, you know, you have Ariella and myself, you can talk to us, but at other medical centers, you should have access to a social worker. Sometimes that means asking your primary physician if they can page a social worker while you're in a visit, or looking up the main number for the social work department. Sometimes it has different names, so it might be social services. For us, it's care coordination. You can also call the main operator at, you know, most big hospitals, and kind of they can walk you through how to get in contact with somebody where you're receiving treatment. Here at UCLA, we also have the Sims Mann Center. They are therapists who are trained in working with oncology patients. They see a lot of our patients, and they really understand oncology treatment and transplant, and they are a great connection. If you have Medi-Cal in the state of California, I don't know if we have anybody who's outside of California, but that is California Medicaid. You can access mental health services through the Department of Mental Health for your county. You can access that online. They also have access numbers for each county where you can call in and receive referrals in your neighborhood. If you have private insurance, you can flip your card over and contact the main customer service number, or if they have a specific carve out for behavioral health or mental health services, they can often give you a list of providers in your area. One thing I would say is, when you are looking for someone to work with, a lot of the work that we do in a therapeutic relationship is the relationship. So it is okay to shop around. It is okay to get a second opinion. For work to be done, you really have to trust and connect with the person that you're working with. So as professionals, Ariella and I, you know, can attest, we are never going to be upset with people shopping around and looking for someone that they connect with. So that is absolutely your right. And I think sometimes patients get a little uncomfortable kind of shopping around and getting second opinions. But just know that it is really important that you connect with the person that you're going to be working with. There is also, like Lila said, a bunch of online support groups right now. So Cancer Support Community, LLS, a lot of places that normally have in-person groups are offering those online. Sometimes it's just good to connect with another patient, someone who really does understand what it's like to be in your shoes. There's peer-to-peer program through LLS. There's also Immerman Angels. And then there's also apps, right? Headspace, the Calm app, things that can kind of train you in mindfulness and the things that Ariella and I were talking about today. So I think, do we have questions, Lila?
Oh, okay. So if you haven't already put your questions in the chat, please go ahead and do so, because we'll just be going into our questions and answers section of this program. But a really big thank you to both of you for all of your expertise and sharing some of those tips and tricks. And I felt like I was sitting here and just kind of trying to know how I felt and kind of doing the 5, 4, 3, 2, 1. Yeah. It would be great if you wouldn't mind also, I did share with everybody the additional resources. You should have gotten that in your email, but if you didn't, please feel free to reach out to me as well. But it'd be great if you could send those strategies of, you know, like looking at different colors and, you know, those grounding techniques that I think would be really helpful as a reminder for everybody who's on today. So a couple questions that have come in, some came in previously, but please, again, go ahead and put them in the chat. in terms of, so one was, I have CLL and doing chemo. How do I get over COVID-19 fear?
So we've talked about things that might touch on this today. But one misconception about our emotions, especially unpleasant ones like fear, is that the best thing we can do is try to get rid of them, which is not true. Our emotions are telling us really valuable information, and we want to use that. We want to hear what they're telling us, and try to pay attention to what's really triggering your fear the most. Are you most worried about coming in for treatment? Are you most worried about something related to COVID? And then maybe use some of the skills we discussed today. That being said, fears of COVID-19 are totally valid. And so we want to encourage you to focus on things that you can control, as Rebecca mentioned before. And if none of the skills that we mentioned today, if you try them and none of them are working, that might be a time to try to get some additional support.
So one question that's come in, could you elaborate on where to find online support groups?
Yes. So what I would do is I would start with a larger group, like going to LLS and looking in the, LLS's website's actually very accessible. There's like 4 patients. You can kind of go and check and find things in your area and do a search, I think by zip code, right, Lila? There's also, like we said, cancer support community. If you type that into Google, they have a couple of different locations. Right now, location is not quite as limiting as it was before, since we're kind of logging in virtually. But I would start there, and then also looking at any medical centers that are close to your home. And seeing what they offer. Like I think in the chat, they were just referencing that UCLA has an adolescent young adult support group right now. So if you were to look around UCLA, you would find that you can look at Cedars and USC and the other treatment centers and kind of see what they're offering as well.
Another question that's come in, how do I encourage my son, who's age 26, 2 months post-treatment for Hodgkin's lymphoma, to talk about what he is going through?
Well, it's obviously a really tough one. And when your child has a diagnosis like Hodgkin's lymphoma, it can impact the whole family unit. I'm sure it has for you. I like to try to remind families that going through cancer diagnosis and treatment is traumatic. And everybody processes that in different ways. And everybody is ready to share and talk about that at different times and in different ways. It's possible that he's already doing things to help him process what that's been like. Maybe he's journaling or talking to a friend. It's possible he's not ready yet, and that's okay. There's nothing wrong with him if he's not ready to talk about it yet. That being said, UCLA does have an adolescent young adult support group, which is a really great resource. Thank you.
Yes, Julia, our coworker, runs that group. She is a glorious unicorn of a human being. So she is lovely. But I think that just knowing that door is open too is really helpful. So you want to give people time to process and give them space, but I think it's great that you have, it seems like you've probably tried to reach out and just saying like, hey, I'm here, sometimes is enough for people to know like, okay, when I'm ready, then mom's there and can listen. And I think that's a really good gift to give your son as well.
Right. Do you have any recommendations for calming anxieties and fears when you have young children at this time and you don't have a lot of time to yourself?
So I used to, in a previous life, I worked with kiddos and not adults. Ariella and I have talked about this. I think that what I learned is that often modeling really good, clear communication and healthy coping with kids can be helpful. So it, you know, they do look to adults to be sort of the experts, but I think it's also validating to hear like, yeah, I hear you. I get scared too. This is what I do. And exploring with them, you know, things that might help them cope, because it's going to be different for them as well. Things like breathing exercises. We talked about when we worked with kids, we used to use birthday candles or balloons, things to do that. So there are ways to kind of incorporate kids into self-care and also give them some skills.
Yeah. Project, you can make jellyfish out of streamers and paper plates, have them blow on the little jellyfish tentacles. But I think that a lot of the time parents want to keep their kids away from the diagnosis. They want to protect them, but kids are really perceptive and smart. They know when something's going on. And so at whatever age level is appropriate, if they're asking questions, I'd recommend sharing with them what's happening. Obviously, really, really young children aren't going to know. They might just need to be told, mom or dad or whoever, it still loves you and is here, and we're going to keep being here. But as they get older, kids can be told more and more. And my rule of thumb is if they're asking the question, then they're probably old enough to hear an age-appropriate answer. And so I think that that's a good way to help kids also process the diagnosis.
Yeah, so when one parent is stressed out, maybe just bringing the kids into the coping as well is what you're saying.
Yeah, and modeling using that, right? Because then you're setting them up to develop good habits for themselves, right? They're looking to us to see what we're doing so that then they can learn. So if you're stressed out, you're human, right? Your kid gets stressed out when homeworks due, or you know, you have to share a toy. That would stress me out when I was a kid, right? Like they know stress, they know their version of it. And so, you know, we're all in the house. If we can model a way to move through it, I think it's good for everybody.
We do have a question. Could you repeat accessing support services at UCLA under Medi-Cal?
So for mental health support services, UCLA, you can go through SIMS-MAN because they don't go through any insurance. So if you're interested in the SIMS-MAN Center, you can self-refer, or if you're in our clinic, Ariella and I can refer you to them. If you are looking for supports close to home and you have Medi-Cal insurance, you're going to need to go through the Department of Mental Health. So I can put the access number in the chat, but also if you're in LA County, I'm assuming if you're UCLA that you're in LA County, if you type Los Angeles County Department of Mental Health into a search engine, it's going to pop up resources for you, and then you'd be able to search by your zip code to find providers. But if you give me a second, I can pull up the website and the phone number.
Yeah, that helps break down. I think LA County Department of Mental Health they're broken down into service planning areas, or you'll see SPA, SPA. If you can Google LA County service planning areas, a map will come right up. You can locate where you live, and then you can tailor your Google search. So you can type in mental health service planning area 5. I think that's the one we're in. But it'll be based on your zip code, and you'll get a list of mental health agencies that you can access for free through Medi-Cal for therapy and counseling.
Great. Another question. So when I'm feeling anxious, when does the conversation switch from trying coping strategies to considering medication?
I think, so this one it's a hard one because everyone's comfort level with medication is different. Some people are more open to trying medications than others, and so might feel differently about doing that. I say that if you're really thinking about it, if you think you might want to try medication, it can't hurt to bring it up to your doctor or your mental health professional. A typical sign for me as a mental health professional is if your anxiety is interfering with your basic functioning. If it's getting in the way of eating, sleeping, concentrating, doing the things you want to do, that might be a time to consider medication. Or if you're like already trying a bunch of coping skills and none of them seem to be kind of doing the trick for you, that might be a time to consider.
Yeah, I think that sometimes patients do have a hesitancy around medication. I think sometimes it feels like a commitment that you're making for a long time. And that might not necessarily be true. You know, it's a tool in the toolbox, right? We want to have as many tools in there as we possibly can because we don't know what situation that we're going to face. And maybe that medication is what allows you to then get to a place where you can access the benefits of all of the things that Ariella and I are talking about today, and then you transition away from it. But you know that if you start to feel like this again sometime in the future, like now you have that kind of noted and in the box so you can access it again.
That's great. Awesome. So this is actually, I think we're at the cutoff time at 6 p.m. So if there's any other questions that people, burning questions people might have, you can obviously always email me. But on behalf of UCLA Health and the Leukemia Lymphoma Society, we really thank you all for joining us here today. We hope that you found it helpful, and we'll send any follow-up materials to you as well. All right. Well, thank you so much and have a wonderful evening, everybody.
Thank you.